There's all different kinds of birth controls that are available, and I always like to tell folks it starts from the easiest, least invasive thing to the most aggressive or most invasive things. The easiest, least invasive things are doing nothing and using a rhythm method or family planning method. To the most aggressive is permanent sterilization, such as a tubal ligation or your partner having a vasectomy. The more effective ones are usually the ones that are more invasive. The least effective ones are the ones that are least invasive. The least invasive birth control methods are typically the barrier methods, and barrier meaning that it prevents the sperm from reaching the uterus. And so you're talking about things like condoms, diaphragms, sponges, cervical caps. The average effective rate with condoms, they're actually pretty good if you use them correctly, and it can be up into the 90th percentile of effectiveness. Diaphragms, sponges, cervical caps probably range in the mid 80 percentile, 85, 83 to 85 percentile. Spermicides you can use in conjunction with those barrier methods. Spermicides are over-the-counter gel, non-oxidol. 9 is the name of the medicine, and it actually terminates or kills the sperm that are trying to reach the uterus. You can use it alone as well, but when you use the combination of those, they do slightly increase the effective rate. Remember, though, that they aren't quite as effective as you go up the next types of methods. The next type of methods for birth control are typically hormonal methods. So we're talking the most common form being birth control pills. There are thousands of types of pills out there, and all generic brands, all types and dosages of estrogens and progesterones. The most common forms of birth control pills are combination pills that combine estrogen and progesterone, and they prevent ovulation. If used correctly, they have an upwards of 98 to 99% effective rate, which is very good. The oral contraceptives, hormonal methods, aren't protective against STIs, sexually transmitted infections, like condoms are. However, they are more effective in prevention of pregnancy. And so pills, like I tell folks, are like tennis shoes. You got to find one that works best for you. And so that's where you meet with your doctor, and it may be trial and error, it may be finding one, and if that doesn't work, you try another one. There's not a magic formula, and if anybody tells you there is, they're not telling you the truth. There's also different kinds of birth controls. There's progesterone-only birth controls that are compatible with breastfeeding, which is really important after you've had your baby. And then when you go to outside of pills, other hormonal type of contraceptions, we have rings that are silicone-based rings that are impregnated with the same type of hormones that birth control pills are. And these rings are placed in the vagina. You use it, wear it for 3 weeks, take it out, have a period, put a new one in, and you can repeat the process. They're very effective too. Again, 98 to 99% of effective rate. You have patches, birth control patches that are transdermal patches that you place on your low back or bottom. And they, again, have estrogen and progesterone and inhibit ovulation. They work quite well with the same type of effective rate. And those are good for people that don't want to take a pill or can't take a pill for some reason or another. The birth control pill or the patch ring are only as effective as you use it. If you have to use it correctly in order for it to be effective. But if you have difficulty with that or remembering to take a pill, then there's some other longer acting birth control. You have something called the Nexplanon, which is a little insert that goes subcutaneously under the skin. It's good for 3 years, has a very good effective rate of about 99.5%. It secretes progesterone and it prevents you from ovulating, so that's how it prevents pregnancy. There's also long-acting reversible contraceptives such as the Mirena IUD. An IUD is a little device, a little T-shaped device that's inserted into your uterus at an office visit with your physician. The Mirena actually has a little bit of progesterone in the shaft of the T-shaped device that secretes progesterone. And again, it's good for 5 years. You don't have to do anything with it. Once you have it inserted, it's there and you don't have to remember to take anything. And it's very effective. Its effective rate's about 99.5 to 0.8% effective rate. Besides the Mirena IUD, which is good for 5 years, there's a copper IUD that has no hormones in it. And it's good for 10 years. Again, it's placed into the uterus at your physician's office, And again, you don't have to remember to do anything, it's there. There's also an injection called the Depo-Provera injection that you can get once every 3 months. It's an injection of progesterone that again has an extremely good effective rate, about 99.5% or so. And again, something that you don't have to remember to do other than go get your shot every 3 months. One of the questions we get after a woman has her baby is, well, what can I use for birth control that's safe, especially if I'm breastfeeding? And you can certainly use barrier methods that we talked about, but you can also use some hormonal methods like progesterone only birth control pills. They act just like a birth control pill, only they only have progesterone. They're a little more time sensitive, so you just have to be good about taking them close to the same time. You could do a Mirena IUD, which again inserts into the uterus. It's good for 5 years. It's progesterone only. You could do the Paragard IUD, which has no hormones in it, completely safe in breastfeeding. You can do implantables such as the Nexplanon or injectables like the Depo-Provera, and those are all safe and very effective in the postpartum period.